So routes of drug administration, second part of the class. So last class we have studied about this major routes of administration: oral, sublingual, rectal. These are the enteral routes, and the parenteral routes we know that it is intravenous, muscular, subcutaneous, intrathecal, medullary, intra-arterial and intra-articular. What is the difference? We will be studying it today. Intra cardiac, the rarely used way, and epidural, subarachnoid route. These are the common pathways for common routes for the anesthetic agents. We have inhalational routes and transdermal routes, which can provide the sustained release of the drugs. And we also have this topical routes. These topical routes, where we use the drops form of the drug or ointment form of the drug for topical use, and some of this topical routes we are preparing in our pharmacy lab also. What were those? Emulsions, creams, lotions, liniments. Okay, most of them are used by topical route. So oral route, it was the commonest, safest, convenient route. Here the sterilization was needed was less, and large amount of the drug could be given. And how is the administration here? Self-administration is possible, and so there is easy to use, patient-friendly. Okay, large volume. All these advantages are there. What were the demerits? Emergency effects cannot be found. The absorption can be less than the expected. First pass metabolism is there. Okay, and there are some drugs which cannot be used by this route. So not suitable for unconscious patients, vomiting patients, emergency drug interactions. Like if we use two drugs which do not go well with each other, there can be negative effect there. That is like milk and tetracyclines. Sublingual route, very small amount of the drug can be administered, but self-administration is possible where the action is faster, and the one more advantage is it can bypass the first pass metabolism. But what happens to the buccal mucosa? If it is used again and again, there can be erosion of the buccal mucosa, and there can also be swallowing of the drug, and this can lead to first pass metabolism again. So demerits, you already learned that bitter and irritant drugs cannot be given, not convenient for frequent use. All these are there. Rectal route, yes, here it needs some technique, so it needs the help of the second person for the administration, but the absorption may be faster. More amount of the drugs can be administered compared to the subcutaneous route or the sublingual route. Okay, but the thing is, it may be cumbersome for the patient. Frequent administration may not be possible, and erratic absorption may be there, though first pass metabolism chances are less. So sterilization, the sterilization required will be less because it is entering the enteral route. Okay, so skills are required, but minimal skills. Coming to the intravenous route, so fastest route. We can be given in unconscious, vomiting patient, emergency method of choice for administration. Okay, all these advantages are there. What are the disadvantages? Some drugs may not be available in that form, and if it is a toxic drug, what can happen? There can always be chances of adverse effects. Okay, so the time required for occurrence of the adverse drug reaction will be very fast. So in the matter of time, you understand that there is something wrong with the patient, the patient may collapse. Okay, so for intravenous route, how is the sterilization required? Very stringent methods and measures should be taken. Complete aseptic precautions should be taken, and the drug should be completely pure, and it should be very standard drug because it is directly entering the systemic circulation, and it should be pure as much as possible. Here, how much will be the dose? Large volumes can be given, that is one advantage. So what may be the disadvantages here? Costly, inconvenient, very specific technique is required. Okay, the specification technique is required. That means a skilled person is required. Only a nurse can administer or a doctor can do it. Okay. Maximum sterilization. Self-medication is not possible. Okay. And adverse drug reactions such as local venous thrombosis can occur if you are not entering the right route and there is extravasation of the blood there. So intramuscular route, again technique is needed but not that much as the intravenous route. Okay, technique is needed, you need to push the needle in the 90-degree angle. Okay, that is there. What happens to the sites of administration? How many sites are there? There are limited sites. Veins are accessible in more regions than the intramuscular site. Commonly preferred intramuscular sites are deltoid muscle and the gluteal region. Okay, so you just need to know the quadrant. That's all. That itself is enough. But in case of intravenous, you need to push it to the vein over the skin, bypassing over the skin, and it should not double puncture. Okay, the vein should not be double punctured so that it will go other side. Okay, so if you do double puncture, again we need to search for newer veins. So what are the chances of adverse effects here in intramuscular route? The chances are there, but we can still monitor the drug. Okay, because the time interval required for occurrence of the adverse drugs may be more than the intravenous route. So we will have some time to revert back, or we will have some time to give a counteracting drug which can prevent the allergic reactions. That should be remembered. What about the subcutaneous route? Is it faster? Yes, subcutaneous route is faster. Yes, it is faster. And what are the advantages here about the subcutaneous route? Can it be self-administered? Yes. So we have some of the routes where self-administration is possible with injection and also faster. What may be the demerits here? Very small amount of the drug is given. Okay. What can occur at the site? If, for example, it is insulin, what can happen? At the site of this continuous administration, after years together, it can be lipodystrophy. Okay. So intradermal route, it is used for vaccination and diagnostic tests, allergic tests, all these things we use a intradermal test. Okay, the needle is passed just beneath the superficial skin. A small blood is created with the help of like 1 drop or 2 drop of the injection material we will be injecting. Very small amount will be injecting. And this route is only for diagnostic and testing purpose. It is not for therapeutic purpose. You can see here it is a vaccine. BCG vaccine can be therapeutic purpose, but rather than therapeutic it is prophylaxis. Okay, vaccines are more for prophylaxis. Coming to the intra-arterial route. Can we inject directly a drug into the arterial system? Yes, it is possible, and we need such a system to see the patency of these vessels or the arteries. Where do you want such things? Where do you want the patency? What is this, what we are seeing? Yeah, it is cardiac artery shadows. Okay, so if there is any block in the coronary arteries, we can find out with the help of this dye, which can be radiopaque, and you introduce it. There is a, you can see here, there is an arrow mark here, you can see a block here. Okay, there is no distal arterial shadow there. Okay, so there is a block there. So based on these techniques, we can identify the blocks, remove that block using a shunt or a thrombolytic agents. Okay, the site is, we are directly entering the lumen of the artery. Demerits is greater concentration the drug is delivered. Demerits is expertise and asepsis is done. Intravenous is more dangerous, but more dangerous than intravenous is our intra-arterial route, because it is a high pressure vessel. Okay, it's a very high pressure vessel, and you need to insert it at the right position. Okay, expertise is needed, asepsis is required, and we are using this radiopaque, contrast, coronary angiography and cerebral angiography. So coming to intrathecal route. Okay, we have this intrathecal route and also epidural route. What are these routes? You can see here. Okay, this intrathecal route, we are injecting the drug into the subarachnoid space. Can you see here? This is the subarachnoid space. The outer coverings, DAP, durameter, arachnoid and pia-meter layers are there. That in that area, we get this subarachnoid space where we will be using this intrathecal route. So what is the advantage here? So if the person is having this meningitis due to some fungal infection or bacterial or viral, so we need to use a drug which can bypass this blood-brain barrier, and there directly we can get the required amount of concentration or the appropriate amount of concentration. Okay, so if you use a oral drug or intravenous drug, there may not be that much concentration attained so as to kill these bacteria or the viral particles. Okay, that is one idea. One more is like for immediate action, maybe like when we are using this anesthetic agents. Okay, so where we need an immediate action and the lower part of the body below that segment all are anesthetized. Okay. So merits is it can bypass the blood-brain barrier and the CSF barrier. Demerits are complete aseptic precautions we need to take. Okay, expertise is needed to introduce into the correct space. So where does our spinal cord end? Lower part of the L1. Okay, so whereby we get this spina bifida. So below that we are introducing it. It is at the in between the L2 and L3 or L3, L4. Okay, this will be the more appropriate sites because it is ending at this area. We can take advantage at the next part. Okay, epidural. So through the vertical interspace between dura and the lining. Okay, so salicylate injection is given. So intramedullary, okay, directly into the bone marrow we can use the drugs. Okay, where we can use it? When we cannot find any veins in cases of children, we can use this. This will be the last form of last resort. For example, a patient is completely dehydrated, it's a baby, you are not finding any vein. This will be the final methods of the administration. And also you might have heard of this bone marrow transplantation. Okay, have you heard of it? Yes. So in case of bone marrow transplantation, we are using the drugs directly into the medullary space. So the common space where we use this intramedullary route will be in children, and it is the bones which we use are sternum and the tibia. Intramedullary, what may be the aseptic precautions we need to take? For intrathecal, intravenous, intra-arterial and intramedullary, all these are very, very difficult procedures, and the asepsis required will be very much of higher degree. And what may be the cost of these drugs? Do you know what may be the cost of this bone marrow transplantation? Yes? What will be the cost of this bone marrow transplantation? Yeah? 10 to 12 lakhs in Indian conditions, but it may be about more than 5 to 10 times abroad. Okay, so intramedullary route. So tibial and the sternal bone marrow, the needle is introduced directly into the marrow cavity. Okay, so Demerits is very fast onset of action. We can compare it with the intravenous route. Okay, so when veins are collapsed in children, you can use it, and also for the bone marrow transplantation. Strict aseptic precautions are needed. Expertise and skill is required because it is very painful and risky condition. Very much expertise is needed. So intra-articular, we have studied about intra-arterial. This is intra-articular, that is in the joint spaces directly into the synovium. You can see it here. Okay, site is directly into the joint space. So what are the Demerits here? For example, there is a joint destruction or joint related disease. There is a septic condition which has occurred there, maybe due to the wounds, or maybe infection which has spread there from other parts of the body. So in order to get this joint access, if you use a oral route, how much drug can enter this joint space? Very, very less amount. So we can use this drugs at the specific spaces. Okay, so high concentration can be obtained at the localized area. So Demerits may be like we ourselves can introduce the sepsis, we can damage the joints. This joint damage is mainly due to the corticosteroids which are introduced there repeatedly. Okay, so if an old lady is your patient and you need to treat the condition, and you need a rapid response and more appreciable response, then what the doctors do? Some of the doctors go for the steroid administration. If there is repeated steroid administration, there can be joint destructions. So where do we use this route? We use it commonly in the chronic conditions, chronic arthritis, osteoarthritis, rheumatoid arthritis, all these conditions. So we have drugs called as DMARDs, or the disease modifying anti-rheumatoid arthritis drugs, which can be used in the joint spaces. It includes gold. Okay, there are many other drugs which are given orally. And one more route is intra cardiac. So directly into the heart. Can we get access directly into the heart? This is the rarest route which is tried. Okay, so the inotropic drugs or the cardiac stimulant drugs can be given when there is sudden collapse of the patient. Okay, maybe in EMI or some other condition where the person may be going for syncopal attack. So in order to give, we first try the cardiac massage, okay, CPR methods are tried, cardiopulmonary resuscitation methods are tried, and finally you can go for direct inotropic drugs, maybe atropine or the adrenaline injection into the direct into the heart. Have you seen the Sherlock Holmes movie? Yes. How is reverted back? He will have a gift there, injection. Okay. So that injection is this. That was adrenaline. Okay. So there are always chances of demerits. Okay, intracardiac. The cardiac system can go for arrhythmias and the patient can die at the spot. But these are the last resorts. Intranasal and inhalational routes. So you need to differentiate between the intranasal and the inhalational route. Okay, inhalational, you inhale it to other parts of the body, maybe it be into the lungs and all, and maybe for systemic absorption. Okay, but here we have the another route, that is intranasal. Okay, maybe intranasal spray when there is a nasal block is there. Xylopentazoline, oxymetazoline, metazoline. These are the drops which are used as a nasal decongestants. Okay, so intranasal route directly into the nose. Okay, desmopressin, it is again a vasopressin-like agent intranasally for treatment of diabetes insipidus, and for osteoporosis we use this calcitonin and GnRH, growth hormone release hormone analogs. They are tried. What can be the disadvantages here? Local inflammation can be there, repeated administration may not be possible. Okay, for example, like GnRH analogs and salmon calcitonin, their absorption will be good when the patient is does not have the stuffy nose conditions. Okay, so that there are some disadvantages this route, and the absorption may be erratic. Okay, you cannot expect the appropriate amount of the plasma concentration. What is this intraperitoneal route? Have you heard of this? Have you heard of this dialysis? Dialysis. Okay. So there are different methods where we bypass the kidney. Okay, when the kidney failure is there, maybe due to diabetic nephropathy or any other condition, maybe chronic alcoholism, which has led to this renal failure, we go for dialysis, that is artificial external purification of the blood. Okay, so we use a method where we have this peritoneal dialysis and hemodialysis methods are there. Okay, where we use a needle into the peritoneum. The peritoneum is used for this. Peritoneal space is used. Have you seen the alcoholic liver disease patients with ascites? Have you heard of the term ascites? Yes, what is it? Accumulation of the fluid is there in the where? Peritoneal space. Okay, so in this condition we need to relieve the stress, because if this peritoneal fluid is accumulating again, it can go into the pleural space. The person may go for dyspnea. Okay, that condition, what we do, we try to remove few liters of the peritoneal fluid. The accumulation may be in the range of 2 liters, 3 liters like that. We can slowly remove 1 liter, 0.5 liters like that. Okay, so we use this peritoneal route to remove, to use access to this dialysate fluid. All this is done. So peritoneal offers the large absorbing surface area for the drugs entering the circulation, but it does not bypass the liver. First pass metabolism is there because the absorption is by portal vein. So first pass metabolism is not avoided here. Rapid absorption takes place. Demerits are painful, risky. Then if the person is not that much skilled, he can damage the intestinal parts. Okay, all these things are there. Coming to the inhalational route. Okay, so can you guess how will be the administration? Is it self? Can it be done self? Self administration is possible? Yes. Do the cost more or less? Convenient for the patient or less? Convenient? Yes, patient can use it. Self administration is possible. It is convenient. Then the cost. Inhalationals Most of the time they are costly drugs. And what happens to this absorption? Maybe less than 10% of which is involved can be absorbed. Okay, so there is high chances of erratic absorption, and also we need to calculate the dose, like only 10% will be absorbed, so we need to administer so much of drug. Such will be the methods. Usually this inhalational methods we used for chronic obstructive pulmonary disease and the asthmatic patients. Okay, so we can also use this method for cyanide poisoning. Okay, cyanide poisoning we use amyl nitrate. Okay, amyl nitrate which can be used by inhalational route. Do you remember any drug which is given inhalational, which is of recent news? Have you heard of Tamiflu? Yes, what is it? What is it? What it contains, Tamiflu? Is it an antiviral drug? It is an antiviral for influenza virus. Okay, we have zanamivir. Okay, that was oseltamivir. We have zanamivir, which is antiviral drug, which can be given by inhalation. Okay, so that is more advanced than the regular oseltamivir. Okay, so we also have this general anesthetics. Okay, such as this, what we call them as volatile liquids. Okay, we have this halothane, N-fluorine, CO-fluorine. All these drugs are used with the help of compressor, and they are administered as a general anesthetics by inhalational route. So beta adrenoreceptor agonists, they act as a bronchodilators in asthmatic patients. Aerosols, powders, they are directly acting on the bronchi, and systemic effects will be less. What may be the systemic effects of this beta to adrenoreceptor agonist? They can provide the tremors. Okay, so the hands will be under shaking condition because they have some systemic effects there. That can be avoided with the inhalation route. So negative points are, I told only 10% may be absorbed here. Okay, we can use the drugs for migraine by this route. Okay, and that is ergotamine, and as powder sodium chromoglycate, it is a mast cell stabilizer again for asthmatics. So do we need a special operators? Yes, we need special operators such as nebulizing machine here. Okay, nebulizing machine is required. Okay, we have the nasal sprays, but for continuous uninterrupted inhalation route we need a nebulizing machine. Okay, so drug must not be irritant. Okay, if it is irritant, the patient may not be cooperative. If the patient is unconscious, it is not possible. Okay, obstructed bronchi, in case of mucus plugs in asthma, there can be failures, but in asthma we have this major indication. So have you heard of this patches which can act as a drug releasing materials? Have you seen this type of patches? Okay, these are the advanced methods where we use the local inflammation. For example, we had a fall there is a lot of pain in that region. We can use a diclofenac patch or a tramadol patch there. Okay, so these are the powerful painkillers, and which can relieve the pain by acting locally. Okay, so here you can see this patch how it looks actually. This is the outer layer, which is an impermeable layer, that is clear packing. So the yellow color thing what you are seeing is a drug reservoir, and we have a porous drug release membrane here, where which you can see the drug penetrating through directly to the subcutaneous fat layer, whereby the lymphatics and the blood vessels they absorb, and thereby their effects can be seen. So transdermal scopolamine, this is for motion sickness. Scopolamine, it is a atropine derivative, where it can decrease the giddiness and also chances of vomiting. Okay, transdermal nitroglycerin. This nitroglycerin is a drug for angina pectoris. Okay, so this nitroglycerin, they act for shorter duration of time. They are very short acting, and there are some concept related to it called as tolerance. Okay, in order to prevent this, both the shorter duration of action, where the patient need to take the drug again and again, that can be prevented, and also the tolerance of it can be prevented with the use of the sustained release patches. Okay. What can be the disadvantages? can we use it repeatedly? The action cannot be faster as we expect. That can be there. Okay, faster action cannot be there, and we cannot use it for repeated administration. Okay, that is there. You can put patches all over the body, but what happens to the sensitivity of this patches? Okay, see, some areas there is thick skin, some areas there is thin skin. Usually over the back of the ear, it is the more sensitive areas to put this patches. Okay. Coming to the topical route. How is the administration in topical route? Is it difficult or easy? Easier way. Do we need the cooperation of the second person? If it is not for oral into the eyes, it can be self-applied. Okay, self-application is possible, and even with this drops in the ears or eyes, it is possible for self-administration. Ointment, cream, lotion, all this can be self-administered. Okay, so what will be the disadvantage? Topical route, how much of the drug can be administered compared to intravenous and oral route? Very less quantity. You cannot administer it very at higher doses. Only small doses can be applied. So we use it for conjunctiva, nasal and auditory routes. Okay, eye drops are used, ointment, nasal drops, nasal sprays. Okay, so what are these solutions? They should be isotonic aqueous solutions. Isotonic aqueous solution means isotonicity with reference to blood or the plasma, and aqueous means they should be water soluble solutions. Okay, so sulfacetamide is an antibiotic, chloramphenicol, it is a traditional